Good morning. Welcome, everybody, to our 9th annual Wild Wisconsin Winter Web Conference. I'm Jamie Machek with the Wisconsin Valley Library Service, and I'm moderating this session and the Small Libraries track today. And assisting me is Jean Anderson with the South Central Library System. And we're so glad you are here. Our presenter for the opening session is Dr. Dipesh Navsaria, an associate professor of pediatrics of the University of Wisconsin School of Medicine and Public Health. A lot of you might know him also for his clinic-based Reach Out and Read program. And he is here with us today with the opening session. So Dr. Navsaria, please begin.
Great, thank you very much. And it's such a delight to be with you on this, at least it's sunny in Madison morning here. So it's really been great to be able to think about the world around us and the role that information plays in it, and particularly about libraries over the last year. So what I'm going to share with you is really some thoughts about the world out there that our public is facing, that our society is facing, about how we can think about the role of libraries, and about how you can think about your own roles in helping with what's going on currently in the pandemic. Now, we have a big role in messaging, and this is what I've been spending a fair amount of time on, because we lock up a lot of things in science in ways that no one can understand. I'm just going to share a few slides with you. I'm not going to dwell on the slides, on the details, because I'm not here to give you a talk on vaccines. If you want to talk on vaccines, we can arrange that. But there's a lot of work out there and a lot of mystery around thinking about immunizations and is it safe and so on. So I designed a set of slides that I use in just a handful of talks I do, just to help people understand this in plain language, right? Plain language is important and key. So preclinical things like vaccines, how does it work is really the question that's trying to be answered. Phase 1 trials, is it actually safe, right? Animals are going to keel over the moment you give it to them. Well, okay, we're not going any further on that one. Phase 2, what's the right dose? Phase 3, is it effective, especially in a larger population, right? Maybe it's effective 40% in, or 60% in the early trials, but then, oh, it's only 20% in, later groups, never mind, And then the approval and licensure process, is it actually right for widespread use? And then does it remain safe when many people are using it, et cetera, right? You don't need to get lost in all this, oh, phase 1, phase 2, oh, combined trials, whatever, right? If people are just saying, I want to understand the process, here you go, right? You don't have to get too sophisticated or crazy about it just by asking, these are the central questions being answered. Again, there's resources out there, and guiding people to those resources, I think, is critical in a way that's easy to understand. Now, some people may want to say, yeah, hang on, I want more than this. Okay, fine. Guide them to those resources as well. But for many people, especially right now when they're saying, I don't understand all this stuff, okay. Here's another graphic that I showed people, right? So we just talked about drug discovery, we talked about trials, we talked about approval, manufacture, distribution. This is the typical way we do any medication process, including vaccines. How many of us have heard people say, oh, I don't know about this vaccine, it was rushed, it was too quick. Okay, I'm going to tell you right now, I looked into this, I read up on it, and I said, wow, this has actually been done really well. To the point that I actually, not as quickly, but as soon as I could, I signed up to be a participant in one of the COVID-19 vaccine trials, right? So I got injected with something, whether it was placebo or vaccine, was of course not known to me at the time, back in September, okay? I put my arm out, this arm, left arm, and got 2 doses of what I later learned when they unblinded me was indeed investigational vaccine. It's the Oxford AstraZeneca vaccine, which is not yet approved for use in the US, but has been in the UK and Europe. Okay, that is how confident I was in what I learned about safety, because, and here's the way I put this in this one graphic, here's the usual process. Well, what they did was, in terms of how did they speed up all these things, they took the manufacture part and did it at the same time as the trials. They had factories making the stuff before it was approved. because if it gets approved, hey, let's roll it out. That's why they were able to approve or authorize the Pfizer vaccine, and it started rolling out within 2 weeks because they had built it up in warehouses. Now, here's the thing. If it gets approved, yay, you have these things ready to go. We got a global pandemic on, can't wait. If it did not get approved because it was, and then you distribute it. If it did not get approved because it didn't work or didn't work well enough or whatever, oh well, sad face, and no distribution happens, and all that stuff goes in the trash. That took 18 months off the timeline easy. Okay, that's not a safety issue or a cutting corners question. It was a financial risk that they took. Yeah, governments took the risk, but again, right? So you've already taken a ton of time off of there. The other thing they took off was a lot of bureaucracy. The FDA wasn't going to sit on this. They were saying, give us the info as you have it, and we're going to review it as it comes in. They weren't going to say, as The Onion said in a wonderful headline, FDA putting COVID-19 vaccine review on the side until it finishes evaluating this bagged salad kit, right? They're not prioritizing the bagged salad kit. They're saying, this is the most important thing going on. Please give it to us right now. So a lot of efficiencies in that, but the review process, the safety and all that stuff, no corners were cut there. I looked into it. I felt confident about it. The other thing is, of course, we can help people understand sometimes very complicated things. People asked me, oh, you've been immunized. So I got the AstraZeneca vaccines, plus I also was eligible for the Pfizer vaccine. Long story as to my decision-making on that. So I've actually had both at this point. And people say to me, does this mean you can now go around and do whatever you want? I'm like, no, actually not. I think of being immunized as being one more layer of protective equipment. I'm still wearing all the same protective equipment in clinic. I'm still wearing a mask in public spaces, et cetera, et cetera, et cetera. Nothing actually changed because we need more data on the efficacy of the vaccine in preventing spread. We know that they seem to be efficacious in preventing severe disease and death. Yay, that's a great thing. We don't yet know about spread because the studies weren't looking at that right out of the gate. We'll find that out later. So things like this graphic, I think, are wonderful. Wisconsin, we got to have a cheese-based messaging slide, right? But it helps us realize, right, that there's many different layers and we need to adhere to these layers. And the great thing is if we miss a few of these layers, right? So if you look at, you just keep forgetting about touching your face and, the ventilation's maybe not the greatest. Okay, but look at all the other layers that keep this from becoming an issue, right? That there's multiple aspects of control. I've talked to schools, I've talked to early childhood centers, I've talked to libraries, all about this. You don't rely on one thing. There's people out there who seem to think we're going to test our way out of this. Nope. Just yesterday, I was listening to a news report, New Zealand, who has done fantastic. They have done absolutely fantastic in protecting their country from this pandemic. Had someone in quarantine, 2 negative tests, followed all the rules, all that stuff, and somehow ended up positive after being released from quarantine. Quickly got re-quarantined, et cetera, right? You can't rely on just one thing. And if they hadn't done a quarantine process, it probably would have done much worse. But again, we don't need to get super crazy about this and start looking at all sorts of data if somebody's just trying to say, I don't understand why I still need to mask if I've been immunized or if this is an issue or not an issue or whatever, right? That these multiple layers help increase it. And again, simple and solid messaging like this helps. And if somebody came in and showed you this and said, I need help understanding, is this actually like a realistic way to think about this, right? How can you help them find the supporting data on this and understand that? That is where you're key and really critical in helping and all that. So you may say, yes, are librarians the right people to do this, right? So much of this is about health and all. I would argue that so much of this is about credibility. And really, so much of what's here is not actually even about data. I'm not throwing data under the bus here. Data and science is really important, but there's something else underpinning all of this. And this is our famed plaque at UW-Madison about this process of sifting and winnowing. We help people sift and winnow that information out there and figure out what is it that's actually meaningful and makes a difference. And this is from Neil Gaiman's The Sandman, right? Most people don't realize how important librarians are. Ran across a book recently which suggested that the peace and prosperity of a culture was solely related to how many librarians it contained. It's possibly a slight overstatement, but a culture that doesn't value its librarians doesn't value ideas, and without ideas, where are we? So I think he made up that book for the story, but that's okay. So, but here's the thing: if you look at studies out there, like this wonderful, I love this, the Society of Chief Librarians. We need terms like that here in the U.S. as well, who pointed out that users trust library staff more than other providers of information, and put public library staff second only to doctors in terms of the trust placed in them by seekers of information. Trust is the actual underpinning of all of this. We have known this in pediatrics for a long time, because we have been dealing with anti-vaccine sentiment for a very long time. And I realized, and many others realized a long time ago, that when somebody comes to you and says, I'm not sure about immunizing my child, it's not actually a fact deficit that's at the heart of that. It's actually a emotion. It's a fear, it's bewilderment, it's feeling lost. If we don't acknowledge that, that's, I think, really important. So if a patron comes into you and comes in or writes to you and says, I'm worried about, and let's say they spout some conspiracy theory that is clearly like just nuts, right? You know, whatever. The first thing, of course, is to listen. Hear them out, let them feel heard. Validate the emotion, right? Yeah, that's some scary things you're hearing, or that's some really concerning stuff. So I think one of the key things we need to look into is, how do we judge what is or isn't true in a world that does offer us these challenges? And now let's talk about how to judge that information, right? And make it about the process, about the evaluation, and so on. We learned that about vaccines, right? That talking about safety, talking about the positives, about the benefits, that all these things, instead of just poo-pooing like, oh, you can't listen to that nonsense. Hey, trust me, you end up a long day. Sometimes I'm thinking that in the back of my head, like, oh gosh, please don't listen to what your uncle sent you on Facebook, you know, like really. But if we blow people off, then they're just not going to come back to us. And I think trust, and the trust that the public holds in the world of librarianship, is really critical and makes you really important messengers for all these sorts of things.